This is the web version of VoxCare, a daily newsletter from Vox on the latest twists and turns in America's healthcare debate. Like what you're reading? Sign up to get VoxCare in your inbox here. On Tuesday, Maine could become the 33rd state to expand Medicaid under the Affordable Care Act. Mainers will vote tomorrow on a long-awaited ballot initiative that, if passed, would expand Medicaid to cover anyone living below 133% of the federal poverty line. That works out to about 80,000 Maine residents gaining coverage, according to the state's nonpartisan Legislative Office of Fiscal and Program Review. Maine would also become the first state to expand Medicaid by ballot initiative, and that could encourage other non-expansion states to take the same route. Medicaid expansion actually has a fair amount of bipartisan support in Maine. Earlier this year, I wrote about a Republican state legislator named Tom Saviello who has repeatedly introduced bills to expand the Medicaid program. "The people I represent need this," he told me. It's as simple as that. The legislature has actually passed 5 separate bills to expand Medicaid. But Maine Governor Paul Lepage, a Republican, has vetoed all of them. Unsurprisingly, Lepage has also been a vocal opponent of the upcoming ballot initiative too. Here's what the governor said in a radio address last week: "This Medicaid expansion is not for children or the elderly. They are already covered by Medicaid. This Medicaid expansion would give free healthcare to able-bodied adults who can work and contribute to their own health insurance costs. I've said it before, free is very expensive to somebody. This time, it will cost Maine taxpayers up to $500 million in the next 5 years. Maine learned this the hard way when it expanded Medicaid in 2002. Lepage is likely citing numbers from Maine Heritage Policy Center, a conservative think tank in the state, that has estimated Medicaid expansion will create an additional $50 million, or $100 million in state spending. But this isn't the whole story. A nonpartisan state office estimates that Maine will spend $55 million extra next year if it expands Medicaid, but will also draw down an additional $525 million in federal spending. So the state kicks in a bit more spending, but gets a whole lot of federal money in return.